Hello, thank you for joining us. My name is Julie Gabbard. I'm a nurse practitioner from the Center for Health and Wellbeing, and I'm talking today with Dr. Brian Trainor about COVID-19 testing, what's available with our practice, and how can you get tested. Basically, there are two types of testing for COVID-19. There are diagnostic tests, which will tell you if you have the virus, if you're infectious, and there are also tests for the antibody that will tell you if you've already had the virus and maybe you have the antibody and you want to donate your blood for convalescent plasma therapy for very sick patients with COVID in the hospital. First, talking about diagnostic testing. There are two types of diagnostic tests. The gold standard is the PCR test, which detects a bit of the genetic material of the virus. This test, and I'll show you this Q-tip here, we would have you insert the Q-tip in your own nose and go around maybe 3 times on the right and go around 3 times on the left. And then we would have you hand us back the Q-tip. We would put it in a small vial of liquid and send it off for testing. That would go out to LabCorp, which is what we use, and it takes about 2 to 3 days to get those test results back. That's a highly accurate test, and it's the test you would want to take if you had no symptoms. That would be the best choice. The next test that's available would be the rapid antigen testing, a test that we do here in the office, and you could get the results within 15 minutes. The rapid antigen is most accurate if you have symptoms. Let's say you have a low-grade fever, or you have body aches, maybe stomach symptoms, or a sore throat. Ideally, the rapid would be used in the first 1 to 2 days of symptoms. And again, you would self-swab your nose. We would walk you through how to do it. On both the right and the left side, we would take the swab from you, take it upstairs and run it in our machine. It takes about 15 minutes for the result. If the result is positive, it's highly accurate. If the result is negative, there's a chance you might still have the virus, we just didn't have enough to detect. We might offer you a PCR swab to follow that up, case by case, which we'll talk about a little more as we go forward. The second area of testing is antibody testing. This would be offered to somebody who maybe already had COVID or thinks they had COVID, has no symptoms, and is just wondering, do they have the antibody? A great reason to know if you have the antibody is you might want to donate your blood to the blood bank. It could be used for convalescent plasma. And that would be a routine blood test, like as if you were getting, let's say you were going to do your cholesterol testing or hepatitis or basic annual blood work anyways. We could also add the antibody to it. Those are the 3 tests that are available, and we offer all 3. How do you get testing? We have limited testing available Monday, Wednesday, Friday morning, early in the morning between 8:30 and 9. We also have a new option on Tuesdays and Thursdays. We're opening a medical tent outside, which will be staffed on Tuesday, Thursday morning by Dr. Brian Trainor, and he's going to tell you a little more about that now.
Sure. Thanks, Julie. It's great to be here today and to represent the Center for Health and Wellbeing in our acute medical tent 2 days a week now. So every Tuesday and Thursday, we will be offering not only COVID testing, but also rapid flu testing, also strep throat testing and other acute care. So this time of year, COVID is, of course, present. However, people are sick with other conditions as well. So as a primary care clinic, we want to meet your needs as best as possible and as safely as possible. So any patient that has any sort of acute respiratory symptoms, whether it's a fever, sore throat, cough, or really anything else that they would be concerned about, they can see me in the tent outside in the morning, and we can evaluate whether they, what type of testing and what sort of physical exam would be best indicated and allow us to proceed with the right treatment. So we are asking that patients call ahead and be screened by a provider before scheduling for the Tuesday, Thursday. And that way we can most effectively decide if you need to stay in your car, if we're concerned that it is COVID or infectious. And if necessary, we'll be able to take you into the tent and do any exams or testing that's needed. And so far, it's been really successful. We've been able to meet patients where they're at while also keeping the rest of our patients in the clinic and our providers safe. And so you can call the front desk to inquire further and to schedule.
That's great. So in the event, let's say a patient had tested, they did PCR testing, maybe they did a drive-through test somewhere, and their PCR test was negative, and they're pretty sure they don't have COVID, but they're having maybe wheezing or a low-grade fever. Would you recommend maybe they call and get screened so you could listen to their lungs, or where would we go from there?
Yeah, so the first thing that we would say is if someone is very sick and is short of breath or has an uncontrolled fever or is very dehydrated, that even if they're concerned about COVID or other sicknesses, urgent care or the emergency room is still the first option. However, this time of year, flu, strep throat is still common, so they can schedule with me. I can do a more comprehensive exam, and as a naturopathic doctor, we can look at both the conventional standard of care treatments, whether it be antibiotics at that time, an antiviral treatment. We can also go over at-home natural treatments as well as supplements and remedies and nutrition approaches to address that. So we have a lot of tools in our toolkit here at the Center for Health and Wellbeing, and we're here to utilize whatever will best meet your needs as a patient.
Terrific. The last category that I forgot to mention earlier would be if you were traveling and you wanted to do testing. So ideally, look at whatever the agency that's requiring the test is asking you to do. Specific airlines, some will ask you to do a PCR test specifically. Some don't specify, so that you have maybe some room to do the rapid. Very important to check with whoever's requiring the test to decide what to do. And keep in mind, if you need to do the PCR test, it's going to take probably 2 to 3 days to get it back. Many agencies will say have a negative PCR within 72 hours. It's a pretty tight window, so you want to plan accordingly. Dr. Trainor?
That is important to emphasize in terms of traveling or other return to work or other conditions that require a test. We do ask that you know which test you need. The PCR is more commonly the one that's asked. However, there are certain cases where they will accept a rapid test. So we ask that you know coming into the visit what you need so we can best meet those needs. And we do provide a cover letter documentation for you to take if that's necessary for you to travel. So, but make sure you ask for that, but we'll provide that for you.
Thank you very much for tuning in. Again, Julie Gabbard with the Center for Health and Wellbeing with Dr. Brian Trainor.